Certified Medication Aide Final Actual Exam Newest Complete 200 questions and correct detailed answers. Question 1. A medication aide, MA, can take an active role in helping to prevent medication errors by memorizing the specific medications of every assigned resident, calling the pharmacist directly to confirm every order is correct, performing only one medication check for each dose given, recognizing anything unusual about an order and asking the nurse for confirmation. As the individual performing the final step in the medication chain, the MA is a critical safety barrier. If a pill looks different than usual, the dose seems high, or the instructions are unclear, the MA must advocate for the resident by seeking clarification from a licensed nurse, LPN/RN. Memorization is prone to human error, and MAs generally do not have the authority to bypass the nurse to call pharmacists for order verification. Question 2. Which of the following is an example of an error caused by a medication aide failing to follow specific instructions for a drug's use? The strength of the medication is not printed on the label. The medication aide did not correctly identify the resident. The medication aide looked up the wrong drug in a reference book. The medication aide uses a pill splitter on an enteric-coated tablet to make it easier to swallow. Enteric-coated (EC) tablets have a specialized outer shell designed to survive stomach acid and dissolve in the small intestine. Splitting or crushing an EC tablet destroys this protection, which can lead to severe gastric irritation or the destruction of the medication by stomach acids before it can be absorbed. This is a direct failure to follow pharmacological instructions. Question 3. What should be reported because even though an error was prevented, there may be a problem with a process that can be fixed to improve safety? Complaints, delays, near misses, refusals. A near miss is an event where a mistake was made, such as the wrong dose being pulled, but was caught during one of the safety checks before reaching the resident. Reporting these is essential for root cause analysis, allowing the facility to identify systemic flaws like poor lighting, look-alike packaging, or frequent interruptions, and fix them before a resident is actually harmed. Question 4. Administering meds with a full glass of water, shaking liquid medications, and storing certain drugs in the refrigerator are examples of special instructions, common guidelines, facility policy, boxed warnings. Special instructions are pharmacological requirements specific to a particular drug. Shaking a suspension ensures the active ingredient is evenly distributed for an accurate dose. A full glass of water may prevent esophageal irritation or aid absorption, and refrigeration prevents the chemical breakdown of sensitive medications. Failing to follow these specials can lead to subtherapeutic dosing or injury. Question 5. Which of the following is an example of a medication error specifically caused by a medication aide, MA, failing to follow facility policy? The MA reports a low blood pressure reading to the nurse instead of giving the medication. The MA does not follow label instructions to shake an inhaler before use. The pharmacy replaces a generic with a brand name and the MA documents the change. The MA leaves a medication cart unlocked and later discovers a missing blister pack. Facility policy strictly mandates that medication carts must be locked whenever they are unattended or out of the MA's direct line of sight. Leaving the cart unlocked is a violation of security protocols that allows for diversion, theft, or accidental ingestion by unauthorized individuals, which is a major safety and legal breach. Question 6. According to safety standards, ISMP, what is the best way to document the quantity of 15 mg to reduce potential errors? 15.0 mg, 15 mg, 0.15 mg, 15 mgs. Safety guidelines prohibit the use of trailing zeros, example 15.0. If the decimal point is faint or missed, 15.0 could be misread as 150, leading to a tenfold overdose. However, leading zeros, example 0.5 mg, are required because they draw attention to the decimal point. Writing 15 mg is the clearest and safest way to document the dose.